Hi, sweeties. How are you doing? Welcome to Naya Sim, and thank you all so much for all the love and support. Hope you all are doing great. So I came across this video where nurse, she said she's a labor and delivery nurse, right? So she was saying that how she treats her black patients, and so she talked about how some nurses will tell you that they don't see color. When they are treating their patient, the truth is that any person that says that they don't see color when it comes to their patient or when they don't see color at all, you all are part of the problem we are facing because you absolutely see color, right? And so she talked about her experiences with black women or how her probably her colleagues also have treated black women during childbirth and all that. You all already know how black women do not they have high chances of not surviving it during childbirth and how they are now taken care of by some nurses during childbirth. And also, they believe that Black women also have high pain tolerance and all of that. I mean, so many things. And all these are the things I look at, and I am like, how do people have this kind of heart to treat people the way they treat people? Now, you all already know that medical rate decision is a thing for those that do not believe. I mean, it is happening, it is real. Black women are experience this like every now and then. It is not something new, it happens, it's been happening to them all the time. Stay glued, let's get into this video.
I'm well aware that what I'm about to say could get me in a lot of trouble, but I think it's important enough to say. I'm a labor and delivery nurse, and I treat my black patients differently. I've seen nurses, especially labor and delivery nurses, online saying things like, I'm colorblind, I don't treat my patients any differently, meaning that they don't treat their black patients worse than they treat their white patients. And here's why it's not enough to be a colorblind nurse in 2023. Because I know that in my specialty, labor and delivery, Black women are more likely than any other race to be harmed in pregnancy, childbirth, and beyond. The US is the worst place to have a baby if you're Black in the developed world. Why is this not happening anywhere else? Systemic racism. If you don't believe me, just Google James Marion Sims. So not only are Black women not believed about their pain, not believed about their symptoms, but also they may put off getting something checked out because they don't trust medical providers for good reason. So here's how I treat my black patients differently. Number one, I don't expect them to inherently trust me because I'm wearing scrubs and a badge, and I don't get offended if they don't. Many black women are coming in to have a baby already having experiences of not being listened to. And until I'm able to prove to them that I'm someone that can be trusted, they shouldn't trust me. More than my white patients, I emphasize the fact that I will always believe them. Yes, my white patients know also that I will believe them, but I really, really drive it home that I promise you that I'm going to believe everything that you say. I include every single person in the room who is supporting this patient in a conversation about preeclampsia, even if they don't have it. Because preeclampsia is one of the leading causes of maternal mortality in the United States. And preeclampsia can happen even after you've had your baby. I tell them about the symptoms, and I also tell the support people that if you hear her saying any of these things, make sure that she gets seen. And if when she gets seen, you don't feel like she's being listened to, go somewhere else. I let them know that I'm here to be their birth bouncer, and I'm not going to let anyone do anything to them, only for them and their baby with their permission. I can neither confirm nor deny whether I have slapped a provider's hand away when the patient said no. I don't know anything about that. I have no hard data to back this up, but I have a hypothesis that black women are not being repositioned in labor as much as white women. So my patients know, and I will say this, that I'm going to turn you like a rotisserie chicken because movement is gold in labor, especially after you have an epidural. If when we have a baby, I don't like the amount of bleeding that I'm seeing, I am early talking to that provider about, hey, what do you think about maybe giving a little bit of Cytotec? What do you think about putting in a Jada? Because postpartum hemorrhage is the leading cause of maternal death. I will always use whatever privilege I have to make sure that my patients are heard. That's why it's so important to treat your black patients differently. And if you're a colorblind nurse, you're part of the problem. Anytime that I talk about black maternal mortality on these interwebs and how we as healthcare providers must treat our black patients differently, there's always a comment like this. Several, actually. And it can be frustrating. That's not even the right word. I don't even have the right word. It can be insert whatever I'm feeling right now to read these comments, because it just proves how much farther we have to go to make sure that Black and brown women are treated based on their risk. Because that's what it is, right? Black and brown women are 4 times, 1, 2, 3, 4, as likely as their white counterparts to have adverse outcomes / death in and around childbirth. So, in seeking to be a bridge, here's what I want to walk through with you. I want to be your gateway drug to wanting to give equitable care. So because you are a nurse, let's walk something out together. Let's say that you are working on a med-surg floor, okay? You've got basic med-surgy type patients, and I give you an admission. And during this admission that I'm giving you, I say, hey, this person is 4 times as likely as all of your other patients to have a heart attack in your care. What are you going to do about that? Would you maybe put them on the monitor? Would you maybe talk to the doctor about drawing some cardiac enzymes? Would you be in more frequently to assess maybe chest pain level or level of consciousness? Would you do those things? Or would you just treat them just like everybody else? It doesn't mean that you're not checking the blood sugar of your diabetic patient. It doesn't mean that you're not measuring the output on your nephrology patient, but it means that you have nursey assessment skills to understand that the risk that someone is carrying around requires different care. And this mentality is just like the all lives matter type of deflection away from the equitable care that our patients need. I give each one of my patients the care that they need and that they deserve. Does it mean that I take care away from the white lady to give to the Black lady? No. This is not a pie, okay? There's no pie involved in this. But just like if I assess with my nursey assessment skills that my patient is wearing a hijab, that tells me, hey, there might be some cultural considerations that I need to go the extra mile for on this person. Is she or is she not comfortable with males in the room? Because I know that there's a male anesthesiologist on today. That might become an issue, so let's talk about it now. If I know that my patient, statistically, is less likely to be believed in a healthcare setting, how is that going to affect my care? If I know that my patient is less likely to have her pain adequately managed, how is that going to affect my care? And if you use your nursing assessment skills to recognize that the color of someone's skin automatically puts them at a higher risk, and that doesn't affect your care, you should not be treating people. To understand that the risk that someone is carrying around.
Okay, this is I love the point of this video and stuff, but I'm realizing, like, I've had conversations on my Patreon recently about this, and I think this line and this line of thinking is where the information does not translate in like a humanized way, right? Like the 4 times adverse impact, like we aren't carrying the risk. Yes, epigenetics and stuff impacts our bodies, but like the risk is that we are interacting with people that don't believe us, that think we yell louder, that read the books. Like it's the books that tell you we don't know our own pain levels. So when you're saying they're at risk, like we're at risk, it's of interacting with harmful healthcare workers. It's not that we walk, like if healthcare was not based in racism, we wouldn't be carrying around the risk, right? So like, I just want to center where the harm is, who is harmed and how. And it's not that we just walk around like it's not like, oh, we're more likely to experience a heart attack. we're more likely to end up in a place where no one thinks we are at risk, for one. So when it happens, everyone is shocked and no one's prepared and no one believes for a long time. And then boom, you know what I'm saying? So it's like, what you should be doing is watching your coworkers more. You should be talking more to your coworkers, not paying special attention to the Black people necessarily. I don't think it's wrong. I just think the harm isn't coming from within Blackness. And I think that's kind of the message that gets spread with the whole 3 times, 4 times more likely to experience bad stuff from white people. I think we miss like the silent part of racism is that it's silently in there. You got to find it. That's the problem. It's not the Blackness. Blackness doesn't increase our risk. Blackness around white people and white systems designed to oppress us, put us at risk. That's why, like, during segregation, when we had all Black teachers, let's just deal with this first. Check out my Patreon. I know Jen doesn't follow me, so like, it kind of almost like reinforces just like my own thing. Check me out. Place.
To understand that the risk that someone is carrying around.
Okay. This is I love the point of this video and stuff, but I'm realizing like I've had conversations on my Patreon recently about this, and I think this line of thinking is where the information does not translate in like a humanized way, right? Like the 4 times adverse impact, like we aren't carrying the risk. Yes, epigenetics and stuff impacts our bodies, but like the risk is that we are interacting with people that don't believe us, that think.
Well, hello there, mutual. I love you, and if you're offended by this video, I'll take it down. Just inbox me. But I was going to make a video very similar to yours. The way that she spoke about it was not taking accountability for her own race. In the context of childbirth, which she used, it was as if something's wrong with Black women that need extra care. Now, if it was surrounding bone density, something like that, that is different from other races, we could have worked with that, but not in childbirth. You said everything. Black people are 4 times more likely to die in childbirth, no matter the socioeconomic status and the health status. Meaning that a poor white person is more likely to survive than a rich, healthy Black person. It's medical racism. But in the end of the video, you mentioned the white supremacist system, which I agree with, right? But only on one level. It is not just white people who discriminate against us. But if we're talking about the safety of Black women during childbirth, we're talking about medical racism towards all Black people, right? So to say and only point out white supremacist system, it limits the knowledge of the danger. Yes, white supremacist system put this in place, but it's not just white people that are threatening our lives. And I know when y'all hate when I say I'm against BIPOC unity, but it is a reality you are going to have to live in. And it is not right to limit it to just white people. And you technically didn't exactly do that. You said white supremacist system. But because you didn't say all of it and then just said white supremacist system, people are thinking white. We are in danger from all non-Black people. Whether you want to do the unity or not, they have slurs for us in their culture. That is important. That is an issue. Because if there is a slur that is known in their culture, their race, their ethnicity, whatever, it means there's a long-standing belief that Black people are inferior. I need y'all to stop playing like your mamas and your grandmamas didn't tell y'all. I'm saying this because I've always talked about this, because I'm trying to protect you. I'm trying to give you awareness. I'm sorry, it's not just white people that you are in danger of. When you go in there and you get a non-black provider, if you get a non-black provider, you are going to have to always be on your toes, because of how this world was structured to hate black people. That bias is internalized. We are the most hated. We cannot sit here and pretend we're not. White people are not our only threat in the medical field, and all of you know it. 10 out of 10.
So this is all I got from this video, and I am not sure that the conversation is not new. This is something Black people have been saying. It's all over everywhere, and each time they talk about it, they don't mind words. It's something that they say openly, right? Because medical racism is something that it's real. Now, I remember when I started talking about Black history, and then from there, I went into medical because I remember you all recommending books, medical appetite, and all that. Then it was at some point, I think it was when I freaked out, was when I read about Tuskegee experiments. That was where I lost it, right? And you all told me to go through medical racism that is happening to Black women and Black people, right? Especially that, most especially Black women. And then recommended the books that I go through them and read. So after reading the books you all recommended, then I started reading too, because I was really curious, like, why would somebody see somebody that needs help, especially when you are in that field and this is what you are paid for? Why would you like have attitude and not do the right thing, right? And it was at that point that I found out that my sisters, I mean, like, you all have been going through it. And then when I found out everything, started talking about medical racism, because a lot of women also came out to talk about what their experiences and all that. One of the reasons why most Black women would rather go to a Black doctor or nurses, because they feel like they are way safer. And then them started also talking about their own experiences, probably with their colleagues, and how they treat people that look like me, right? So it's at that point that I knew that something is really wrong with some people, because I feel like this is not normal. I mean, I don't know how you want to say it, but there are some certain things that are not normal. But it looks like some people, this is already how they operate, especially when it comes to people that look like me. So it was also at this point that I found out that to them, they feel like we don't feel pains, or like, our pain tolerance, it's very higher than theirs. Then I got to see experience people's like pure life experience, true stories, experiences of how they went to the hospital, that they were almost like passing out and asking for pain to reduce what was happening to them, and they didn't even, you know and then at some point, I remember that I think I also talked about it here, how Black women also decided not to, like, when they're going to the hospital, you are not going with that strong face or that strong Black woman that you are. You are also going there to throw tantrum, especially when they do not do what you ask them to do. And when you know that you are going through so much pains, you already know how they go through pains. You see them really crying. We are always, you have this bold face that will come out. You still, like, you might still look strong, and you are telling them that you are in pain and nobody is understanding you. So activate that cry, because I mean, we also have cry, we also have tears, I mean to say. So make sure you activate it, because this is something that has been happening. It is not new. Medical racism is not new. My people have been going through this from the onset to this very moment. So what am I saying? In essence, what I am saying is that we all deserve better, right? And I am going to encourage every Black woman, except you. Some people may have, some people are also very lucky that they ended also with maybe not someone that looked like me. And the person was really great, like, OBGYN, or what they call it. I think OBGY something, right? And they have good doctors and all that, or nurses to attend to them. But if you are sure that you are not safe, or you are not in safe hands and all that, I absolutely we advise you that you look for your kind. And also sometimes make sure that you have your camera, because I remember them saying that why is it that Black people, each time they are with the doctors, that they are alone, but they are not always alone, because they have somebody on the phone talking with them, or there is something they are recording. They know why they ask that. They know, but you know how they do already. So let's continue activating our tears, because it looks like that tears are something that they've been looking for. And make sure you look for your type, people that look like you, especially when you are going through some certain things, giving birth and all that, because you all know that a Black woman, like, chances of survivor during childbirth, it's not a lot. And you don't have to take that risk. See you all in my next video. Bye for now.